I think turning 19 is just inherently a slightly nerve-wracking experience. And youth and care are generally thrown straight into everything. You've got to figure it all out at once, and everything's happening at once, and you don't know how to navigate it.
Rachel is getting on track with skills like grocery shopping and setting up her career path. But for many youth exiting care, it's a precarious time when becoming homeless is a real possibility. An art installation called the 19th Birthday Party has been touring places like Surrey City Hall to help draw attention to the need for better bridges out of foster care.
What we know is that if youth exit foster care, oftentimes they exit into poverty and homelessness, and it becomes a recurring theme in their lives. And that's something that we really want to make sure that we stop before it starts.
Foster care graduates aren't alone. A regional summary of homelessness data looked at what was going on in people's lives before they became homeless. And several situations became clear.
We have a lack of sufficient social safety nets for Metro Vancouver's most vulnerable, including the working poor, seniors on fixed income, First Nations, foster youth aging out of care, and people with chronic health issues.
Regional mayors are drawing attention to the data and calling on the provincial government to take action.
Every day, 5 additional people in Metro Vancouver fall out of housing and onto our streets.
Among the identified situations that can lead towards homelessness is exiting prison with nowhere to go.
If you go to prison for less than 3 months, you're not provided any assistance or support to do planning for where you'll go to live after you're released from prison. So that's the biggest link between homelessness and incarceration. Why are we forcing women to lose custody of their children, to lose their homes, and have everything about their life disrupted? It doesn't make sense.
Agencies like the E. Fry Society are able to assist a small fraction of the 30,000 British Columbians who enter prison each year, despite the captive audience, to get their paperwork in order.
Do you need ID? Do you need to be able to file your income tax? Do you need to clear up warrants that are out for your arrest? Because if there are any of those, you can't get social assistance. And so those are all really good things to tackle while you have the opportunity, while people are incarcerated.
The cost of goods, services, and housing is overwhelming many in Metro Vancouver.
We've seen real difficulties in people accessing housing across the region because welfare rates have been frozen since 2007.
I think it's pretty simple. We need more funding for affordable housing. Even if you can find a place, then you end up spending more than you can afford, and then you've got no money left for food and other necessities.
You miss a check, and next thing you know, you just can't catch up, right? Your mortgage is gone, and we live check to check these days. Most of us are so in debt. This could happen to all of you.
We know many homeless people have brain trauma. We know that many homeless people have suffered abuse, emotional, physical, sexual abuse as children. We know that they have chronic health conditions.
Jane's health diagnosis triggered unemployment, then welfare. She moved into a windowless room. Then she tried a shared house.
There wasn't supposed to be any drugs or alcohol. Well, there was, so I left. I moved into a converted garage, which was $500 a month that I really couldn't afford. No heat. It was basically a room.
In order to catch people before they fall, Metro Vancouver leaders recommend improved home care, including for addictions and mental health, secured housing upon release from incarceration, and attention to childhood challenges.
Particularly upstream things, working with schools, with the Ministry of Education, identifying high-risk families, high-risk youth, high-risk children before they enter into homelessness or the cycle of couch surfing.
An increase in the supply of rental housing is obvious. We absolutely have to provide housing for people with incomes below $30,000 per year. We need measurements so that we can understand whether we're actually producing a positive outcome.
Meanwhile, Rachel is managing to move forward.
I am 25 now, so I'm officially an adult and finally feeling I'm starting to get there.
She's been empowered by initiatives and people who emphasize community and human connections.
We hope that the work that we're doing can contribute to that a little further upstream prevention work. I think there's something to be said for how good it would feel as community members to be in a community where we know we all care about one another, and we ensure that folks who have experienced homelessness or who might be on that pathway receive the kinds of supports to ensure that they don't have that experience in life.